Hi, everyone. I'm Emily Howard. I'm the Vice President of the board here at MS Auckland and also someone living with MS. And so I'm joining you today as part of the governance body, but also as a community and society member. This webinar is part of MS Auckland's ongoing commitment to our community. It sits really at the center of what we try to do, which is inform and guide our members and support the wellness through practical expert-led sessions like this one. We know that living with MS means having access to the right information at the right time, and that's what today is all about. So we're thrilled to be co-hosting this session with our community advisor, Catherine Glover, who will manage our questions. Please drop them into the Q&A area or chat, whatever is best, and we'll be taking questions at the end. So feel free to throw those in there, but I'm sure Elizabeth will be happy to answer them. And now I'm very pleased to introduce Elizabeth Colfax Brady. Elizabeth is a registered nurse, continence advisor, and retired midwife with more than 40 years of healthcare experience across rural and remote Australia. She now works with Tina Healthcare, supporting best practice in continence care for community and aged care. Elizabeth also brings a personal connection to MS as a parent and advocate, and we're very, very grateful for both her professional insight and lived experience. Welcome, Elizabeth.
Thank
I
you.
can't wait to hear what you've got for us.
No, no pressure. Thanks, Emily. Thanks, Catherine. And hello, everybody. It's very exciting to be here, and thank you.
Urination is controlled mainly by the micturition center in the pons. This center receives sensory signals from the bladder and communicates with the cortex about the appropriateness of urinating at the moment. At times when it's not convenient to urinate, the center sends back an inhibitory signal to keep the sphincters closed and prevent voiding. When you wish to urinate, this inhibition is removed. The spinal cord instructs the muscle of the bladder to contract and the sphincters to open to let the urine out.
So I hope that was it's just a little quick video and showing you how the bladder is emptied and how
human body contains 50 to 70% water, of which about 2/3 is located inside the cells.
Hang on a second.
The other 1/3 is in the extracellular fluid and blood plasma.
Go away.
Water can move freely between different compartments in the body, but its direction is determined by which compartment.
Sorry about that, guys. We're getting a double whammy there. Oh. Okay, I think we're back again. Yep. Back again. Is that right?
Yes, we can see your screen now.
Okay, thank you. Oh, it's always the way, isn't it? I'll just carry forward a little bit. So I think we're up to this one. So incontinence is a common symptom for people with MS, although the severity and the longevity, I think I said this bit before. Yeah, it's more common in females, and we talked about the bladder. Yep. So just to recap on that, MS can disrupt the nerve signaling between the central nervous system and the bladder and the disruption flow of the nerve messages. So you can see, because that part of our brain at the back of our head called the pons can be quite affected by some lesions in MS. And so therefore that stops that message that can come back down to your bladder and bowel to go to your micturition center. That's what it's called. It sends messages down to your bladder and bowel at what time to go to the toilet, and you get that feeling to go to the toilet. So because the lesions or come over those may occur in the spinal cord also, which may directly affect the nerves arising from the spinal cord and also lose control of bladder and bowel. There's some little pictures there of some lesions. Within people with multiple sclerosis, the neurological damage from MS slows or disrupts those signals. We can get muscle weakness from that, or rigid muscles, or poor coordination because of it. The mobility limitations can delay reaching the toilet. Medications, especially muscle relaxants or pain medications, often cause constipation, and fatigue makes it hard to plan ahead or follow routines. And we all know about the dreaded fatigue. It can influence all these things that we do in our life. So let's have a quick recap of what incontinence is as well. So incontinence is the accidental or involuntary loss of urine from the bladder, which we call urinary incontinence, or bowel motion, feces or wind from the bowel, and we call that fecal or bowel incontinence. There's 4 main types of urinary incontinence. The first one is called stress urinary incontinence, urge or overactive bladder urinary incontinence, mixed urinary incontinence, and functional incontinence. And we're going to cover some of those things today. Stress urinary incontinence occurs when urine leaks from the person who is coughing or sneezing or laughing or exercising, commonly caused by pelvic floor weakening or damage such as childbirth surgery, and can be caused by obesity. The pelvic floor is basically a big group of muscles that provide support for the internal organs. And with urethral sphincters, the pelvic floor helps to stop urine leaking from the bladder, especially during periods of physical exertion. Now, the reason I want to talk about these types of incontinence is you can see how it can lead back to with MS, how it affects these parts of our body. Urge incontinence usually occurs when there's unexpected or involuntary, where the bladder empties without warning. Involuntary contractions of the bladder muscles can occur because of damage to the nerves of the bladder, or to the nervous system, or to the muscles themselves. We talk about mixed urinary incontinence, and that's when you just have a different sort of incontinence. At one, you might have urge incontinence, and you might have stress incontinence, and we just call that mixed incontinence. So one of the major things that happens when we have incontinence is what we call functional incontinence. So functional incontinence means when a person has normal voiding function, but incontinence occurs as a result of physical barriers, cognitive barriers, environmental barriers. So you can't get to the toilet. Some people with medical problems and disabilities, it may interfere with their thinking or communication, which may lead to trouble getting to the toilet. And it's common in MS sufferers for their decreased dexterity or toilet distance or location. So that can mean that there's nothing wrong with their actual pelvic floor or their urethra or anything like that. It's just that they can't get to the toilet, and that can be quite distressing. Some of the actual problems that come along with urinary problems in MS is the urgency and feeling like you need to go immediately. Frequency, needing to urinate often. Nocturia, meaning waking up multiple times in the nighttime. Incomplete emptying, but you still feel like you're full up. And sometimes retention with overflow. So sometimes the bladder holds too much and then leaks out, and there are issues that can cause that as well. I've just put this little picture here just to remind us that this is how much urine we usually make in a 24-hour period. So our kidneys normally produce 15,000 to 2,000 mils of urine every 24 hours. Of course, it depends on our fluid and food intake and perspiration, but it's important to remember that for later on when I'm going to talk about the absorbencies of some of the products that we can, which we supply to help manage incontinence. Some of the bowel issues that can happen with MS is constipation due to reduced gut motility and less physical activity. Urgency or accidents, especially if the rectum doesn't signal in time to go to the bathroom. Loss of sensation, you may not even be aware of needing to go. Overflow diarrhea, and this happens sometimes when the bowel has got too much feces in it and it's become hard, and then the soft part of it leaks around it, and that can be quite a medical issue. If you're not emptying your bowel properly, but you're still oozing a little bit of fecal fluid, you think everything's not so bad, but it can cause a real issue, and can be quite a medical emergency. So it's always worthwhile, if you're having problems around being able to go to the bathroom, to have a talk to someone about it. And also flatulence, meaning farting or passing wind, can be a symptom of fecal incontinence as well with MS. I've got this little picture of here of sitting, how we should go to the toilet. If we can get to the toilet, we should always have our knees above our bottom so we can get to the toilet. So that's just a reminder. It is worth remembering that other influences, not just MS, can contribute to the urinary and fecal incontinence. So you may have MS and thinking that it's because of that you've got these issues, but childbirth, menopause, prostate issues, diabetes, obesity, decreased mobility, poor nutrition, side effects from medication, or neurological diseases, example, Parkinson's, may influence some of your urinary symptoms as well. So don't just presume that it's because of MS. It can be from other causes as well. If you were going to come and visit me and I was going to do a continence assessment today, I would say that the goal is to provide targeted interventions and support. And sometimes you may need a referral to a specialist gynecologist or urologist for underlying conditions. And then we do advice on pelvic floor exercises. But for today's presentation, I'm going to concentrate on the last three, which I would talk about well-being and lifestyle advice to support better bladder function, equipment or strategies to manage difficulty going to the toilet, and suggestions for products to manage symptoms like leakage. So diet really is important, and I think no matter what system of your body that we're looking after, you definitely need plenty of vegetables, good whole grain foods, good meat source and protein source, and milk and yogurt and cheese, but a really good diet really helps in managing any body problems. Like, we all need to have a good diet. So MS and continence is part of that. Also within MS, it's a good idea to regularly eating regularly is good for stimulating your bowels. And the most active time for reflex that we talked about before, that reflex from your micturition centre that can affect your bowel as well, is around half an hour to an hour after your meal. So skipping meals, especially breakfast, can lead to sluggish or irregular bowel movements. And making sure you've got enough fibre in your diet can make a positive difference to constipation. It can reduce the need for bowel medications such as laxatives. And in general, most adults need to eat at least 30 grams of fibre a day to keep them regular. Hydration is really important for bodily function, especially for urinary symptoms. And what happens sometimes, people who have urinary incontinence especially, is that they think that they should just stop drinking a lot of water, and that can be what we would say in the medical term, it's a paradox. So if you drink less, you actually it can irritate, it can make you dehydrated, and then the body lacks water. It will make the urine more concentrated. It can irritate the bladder and lead to increased urgency. So you need to be aware that in many cases, staying properly hydrated can support your healthy bladder and function rather than making the symptoms worse. So don't overhydrate, but don't underhydrate as well. So you need to be, have I can't say exactly how much to have because we're all a little bit different, but, you know, at least a drink with every meal and one in between is okay, but don't try and not drink. One of the ways of also looking after how to manage some MS issues is to think about your environment. So how we can access the toilet easier. So we need to declutter or rearrange the furniture in the bathroom, remove anything that can trip over or the floor rugs or the mat on the way to the path to the toilet, perhaps leave a light on in the nighttime, install handrails in the bathroom, use a raised toilet seat to provide better stability, use a commode chair for easier access. If the toilet's a long way away from your bedroom and you're having some nocturia, you like to get up, you can use a commode at the side of your bed. The gentleman can use urinal bottles. Try and wear clothing that's easier to undo and get off and on easier, like elastic waist or Velcro fastening, because all of those things help you manage your continence and make it so you can have a better life and be able to get out and go out and enjoy your life by just changing a few things that will help you with that. Some of the psychological or psychosocial issues that we talk about sometimes is that a lot of people think that they have a fear of drinking liquids. So some people really do try and stay away from it, and that's not good. Some people can have loss of anxiety over control, particularly during social events. So they might wet themselves so that they're going to stay home and not go out, like fear of going out or fear to be too far away from the bathroom. Embarrassment and shame from any leakage episodes that happen. Fear of incontinence during intercourse. Increased fatigue due to interrupted sleep. And fear and embarrassment are related to catheter use. I'm not going to go too much into catheter use today because that is a specialised treatment that we would need for some people. Suffice to say that sometimes it can be really difficult for people to cope with that. I'd like to now just review some of the issues that we have when it comes to talking about incontinence or the feelings about incontinence. So I'm going to read these out because I think it's really important that we acknowledge some of the feelings about incontinence. So each time I lose control of my bladder, I feel like I need to have a shower, and that can be up to 4 times a day. I had an accident at the supermarket the other day and I was mortified. I always think that people can see the pad or even hear it, or worse still, smell the wee. I know I should speak to someone about this, but it might uncover more serious problems, so it's better not knowing. Not being able to control yourself is the worst feeling in the world. I run my own company and I've been very successful at it, but now I cannot even control my bladder. I just feel like a baby. It really knocks you around. I'm always worried my husband will find out and start looking at me differently. I'm recently single and it's not like I'm going to find someone now. I mean, imagine if she found out her new bloke had to wear his pads. So I think it's really important that you be gentle on yourself and not think that people think those things, although inside we do. But be aware that these are quite normal feelings to have sometimes when you've got incontinence, plus having MS as well. So try and just be gentle on yourself and acknowledge that these feelings can come, and that it's not going to and hopefully not impact too much. I did read in MS Auckland there is a very good webinar from Nicola Duncan from Hearts and Minds, and she does look at those issues quite well. So if you wanted to, you could get to that resource and have a look at it. Now I want to talk about a continence assessment. So this would be what would happen if we do a continence assessment. And it's really valuable for you to understand these things, and this is how we help manage so you can become able to go out and have more fun in the world. So we always take a history when you come to have a continence assessment of anything that's happened to you ever since you might have had problems since you were growing up, even before you had your diagnosis, or anything like that. So we find out history. We usually do a clinical assessment and have a look and see what's happening down there and see, if you've got any issues. Sometimes when we're doing a continence assessment, we may do a bladder assessment or a bladder diary, and that would involve that we would ask you to take a record of how often you go to the toilet over a week, and you can come back and see how many times or what time of day you're going to the toilet. And sometimes we would do a scan of your bladder if we need to see if there's any real issues on its emptying and things like that. So there is a component of trying to find out, this is all trying to find out how we can help you the most. Certainly the same goes for a bowel assessment. We'd make sure that there was nothing physically wrong with you. We may do a bowel chart as well to see how many times you're having your bowels open. Make sure you don't have feces caught up in your rectum, things like that. That would be something that the continence nurse would check on as well. Then we try and identify the type of incontinence and management strategies, and then try and work out a continence care plan for you, including lifestyle strategies, containment strategies, and also looking after your skin. And then again, we have to evaluate to make sure that all of that worked, and we might have to go back and do it again. So the objective of containment strategies is to maintain your ability to go out, right? So maintain a normal life. So when we talk about containment strategies, it can be with a continence product, and I'm going to talk about some of those in a moment, or bed protection. And there is sometimes indwelling catheters that we talk about as well, or a condom drainage for some of the gentlemen. So there are different ways of containing the urine output and bowel actions as well. There are some containment strategies in place. So all of this is to try and be able to keep you socially able to go out and enjoy your life, and also not have that anxiety of having wet and dirty linen or clothes or anything at home. So here's a picture of all of these continence products that exist with Tenor. And there's men's pull-up pants, and there's female pull-up pants. There's products that you could wear all night to keep you, that would hold nearly 3,000 or 4,000 mils of urine. Remember, I talked about what amount of urine we passed in the daytime, and it's 1,500 to 2,000 mils. So when you're choosing a product that you think that you might want to use, you need to understand how much you're actually leaking, because you don't want to spend a lot of money on some fantastic looking pants and they're not going to be the right product for you to contain your urine, and it may be that you're going to spend too much money and not be able to and then you'll run out and you'll have to have lots of bulky products underneath when you only may be using just a small pad with little dribbles in it, and that's enough for you. So it's really important to have that continence assessment and try and work out how much urine that you're passing. And it's not as much as you think it is. And again, if you've got fecal incontinence, then you would have the lowest absorbency of a pad, because then you can change it every time you have some fecal incontinence as well. We'll also have to think about the skincare and make sure that you're looking after your skin, especially around the perineal area, and that it's going to be looked after, and the skin cleansing is done really well every time you go to the toilet if you're using a product. And some people think, oh, well, I'll just put one pad inside another pad, and I'll put two on and I'll take the other one off when I, and and do it that way. But it doesn't work that way because the products don't go from one to the other. They actually contain, so they don't leak. So if you put stuff inside of them, it's going to cause pressure on your bottom and pressure on your genital area, and that's not very healthy. That's not good for it. So doing 2 pads and putting extra inside is not good. So trying to get the right product at the right time is the best thing to do. Have a little talk about feminine hygiene products. They're not designed to absorb urine. They're designed to absorb menstrual flow. So because their products are made a different way. So the products in the pads that we have, they're these little tiny super absorbent polymers, and they turn into a gel when they get wet, and the fluid is locked into it, and that prevents leakage by keeping moisture away from the skin and prevents skin irritation, and it can absorb up to 100 times its own weight. So some of the products can hold quite a lot of urine, and it also controls odor. That can make you feel more confident to go out as well. The thing with our continence product and the way that they put these, as you can see, there's little top layer, distribution layer, the core layer of all of the way the product's made. The feminine hygiene product can't have urine, but these products can contain the menstrual flow as well. So if you do have continence issues, you don't have to use 2 pads. You can actually use the 1 continence product for feminine hygiene as well. So we talk a little bit about funding assistance and I'm not quite sure in New Zealand, you can go to the Ministry of Health to get some funding assistance, as far as I can understand, and also in www.continence.org.nz. There's more information on how to get some information, how to get finance and how to get access to some products. And here's the spectacular public toilet map that this is one for Auckland, but there is one in all of those other centres as well. And I think if you go to this website, you'll see that there's if you go to Toilets NZ, you'll see there's so many different places for you to get to, and so many different toilets to get to. So when you're out and about and you're trying to plan your day, and so you don't have to worry about leaking, you need to you don't need to, but it's a good idea to know that where you're going and is there a toilet around this. Because what we hope, and what I would hope, is that you get to live your life a good way, and that you can not sitting at home and worrying about the toilet. So if you get organised and find out where they are, that's a really helpful thing. And you can also decide which product to take with you, and take a little plastic bag, even if you can't find a receptacle to take it, because remember, our products can't go down the toilet. They need to go into a refuse bag. So plan your day when you're going to go out, so you don't have to stay at home. Take an extra pad with you and see where the public toilet map is, so you can get to go out and enjoy the day and live your life. So just to recap, Tena has a lot of products, and you can go to www.tena.co.nz and you can get sampling from there. So if you're unsure of what products that you might need, then you can get sampling to be sent to your home so you can trial it. And that's a really helpful thing to do when you're trying to find out what the best product for you would be, because you don't want to spend a lot of money on a product that's not going to help you keep your continence as you go out into the world. So you can go to Tena and have a look to see how it will help you. And also there is a customer care number in New Zealand as well that you can get some helpful advice on continence management. There's my references. And I think I've gone too fast. What do you think? Maybe we've got some questions.
Right, I've unmuted myself. There I am. Okay. Thank you, Elizabeth. That was fantastic.
Told you I talked too fast.
No, you don't. You're wonderful. Okay, first question. What
I've got a
role
plane.
does...
Hang on, I've got a plane going over.
Oh, you live in the fast lane. Okay. What role does autonomic dysfunction play in continence?
Autonomic dysfunction.
Autonomic dysfunction. Like with the autonomic system.
Yeah, I'm having a think about that. As we were talking about, we know when we're talking about the mental part of like your body can do things without you thinking about it, and that's what autonomic functioning is. So you don't even know that you're thinking about it. So autonomic means the involuntary or unconscious way of thinking about things. And your question is, how does that impact?
It says play with incontinence. I guess, yeah, how it impacts incontinence or continence.
Look, I think when it comes to continence management, I'm just trying to get it into my brain. Depending on what neural pathways have been affected by any lesions that you might have in your brain, that could affect the pathways that would lead to that it's time to go to the toilet type feeling. And you may not get that feeling because that pathway doesn't happen anymore. So you don't get a sense of urgency. So you would have dribbling or just passing urine. And that's why when we're doing a continence assessment that we look at, we do a bladder diary to find out when it's happening and did you know it happened, and you need to tell all the things around managing that. So I would, it does impact, and it can impact in MS. That autonomic system impacts on MS, yes, depending on where the lesions are. Does that make sense?
Yeah, that's fantastic, Elizabeth. Thank you. Now, there's a couple of people who want to ask questions directly.
Yep.
However, I want to warn people that they can't be of a personal nature. They've got to be generic.
Yeah, it can't be personal. Yeah.
Can you, once incontinent, if you want to change this about, can your brain create a new pathway?
That is a very good question, because we often talk about plasticity of the brain and what other pathways there are. And again, I would say, depending why you were incontinence, I don't know enough about plasticity, but some people say, yes, you can, if you really concentrate on brain plasticity, that it will help grow back pathways. But I can't comment on that because it's not my expertise. But finding out the exact reason why you've got the incontinence in the first place, and what reason it is, and then work from there. Because if it is due to because you've got stress incontinence and you've got a very weak pelvic floor, then you're going to you can do exercises for your pelvic floor to strengthen it. Definitely, you can retain some control over your bladder that way. But the pathway, if the pathway's been damaged by any lesions, then I would say, not to my knowledge, that you would be able to do that.
Okay, one last question, which follows on from what you've just discussed about the pelvic floor. Can strengthening your pelvic floor help reduce urinary urge incontinence? Do you have any other strategies for urge incontinence? I have tried a few, counting backwards in sevens, etc.
Yeah. Well, obviously, I think pelvic floor is probably one of the better, of course, that's a good one to do. I think with urge incontinence is if you've got no control over when it's going to happen, that sounds like what the issue is, and so you can get caught out a lot. I don't know whether whether you would want to try using a product to stop those urgent ones. And again, if you came to see us, we try and do a diary, a bladder diary, to see when things particularly happen. And at the same time, we usually do an intake diary as well. So what did you drink before then? Did you have lemonade or did you have whatever? And then we try and look to see if there's any correlation between what you're putting in the top end coming out the bottom end for the urge incontinence. So keeping a diary for a week, even for yourself at home, is really helpful to find out when these episodes may be happening. And I recommend that you can use it. So you can go out and not be caught out with urge incontinence, then try and have a product that will keep you dry, so you can at least have some social interaction. But get some guidance on how to do a diary bladder, a bladder diary.
Yeah. And thank you so much.
Pleasure.
Really appreciate it.
Yeah, Elizabeth, thank you very much. This is not a fun topic. I know a lot of people, like you say, are embarrassed, and I really appreciate those thoughts and putting it out there, because, it's the thing that we kind of don't want to all talk about. So thank you for making us feel safe, and thank you for giving us some good knowledge and strategies, and at least avenues that we can talk to our doctors and our GPs and our nurses for, to get us some of that relief, because we want to live a whole and healthy life.
Yeah.
And that's why we're here. So thank you, Elizabeth. Thank you, Catherine, for helping to coordinate all of this. And thanks to everyone watching.
Thanks everyone.
And if you guys, these are free webinars. I'm not gonna ask for money, but if you do feel inspired to donate to MS Auckland, look, every little bit helps. So thank you again for joining us today, guys.
All right. Thank you, everyone. Nice to meet you.
Okay.
Take care.
Bye.
Bye.